You are at the gym, right? Setting up for a heavy squat, or maybe you're just out with friends and someone tells a joke that hits you exactly right and you let out this massive laugh. Or maybe you just sneeze.
Yeah, the classic sneeze.
Right. And then it happens. You leak. It is, well, it's incredibly common, affecting up to 50% of women. Yet it is something almost nobody talks about openly.
No, they really don't. It's the kind of um, silent burden that forces people to constantly alter their daily lives. You know, you find yourself mapping out where every bathroom is, giving up high-impact sports completely, or like constantly changing wardrobes just in case.
Just in case, yeah. But what if a simple 5-minute injection could fix it? No major surgery, no long hospital stay, just a quick injection.
Which sounds amazing, right?
It does. But here's the massive catch. Once you inject a gel into the human body, what on earth stops it from moving around, migrating, or, just getting squished completely out of place when you go back to doing those jumping jacks?
That is the million-dollar question.
Exactly. So, welcome to today's deep dive. We've got a really fascinating stack of sources today. Clinical reviews on urethral bulking agents, historical FDA data, and some really revealing recent animal studies.
Some wild stuff in there.
Really wild. Our mission today is to explore this incredible intersection of biomechanics, material science, and pelvic health. We're looking at how medical science treats stress urinary incontinence without major surgery. And specifically, we want to know what precautions keep these injectable fillers from migrating or just getting displaced during high-impact physical activities. Okay, let's unpack this.
All right, so to understand how we keep these materials in place, we first have to understand the biological mechanics of a leak. Like where this injected material is actually going.
Right, lay the groundwork for us.
So we're talking about stress urinary incontinence, or SUI.
Wow.
Fundamentally, this is the involuntary loss of urine when your intra-abdominal pressure increases.
Okay, but that's the coughing, the sneezing, the heavy lifting.
Exactly.
You're physically creating this, pressure wave inside your abdomen that just pushes down on the bladder.
And that pressure wave is significant.
Yeah.
A violent sneeze can generate an immense amount of intra-abdominal force. Now, SUI is usually caused by one of two structural failures.
Okay.
The first is urethral hypermobility. That's where the physical support structures are weak, and the urethra literally drops down under pressure.
Got it.
The second is intrinsic sphincter deficiency, or ISD. This just means the sphincter muscle, the one that is supposed to pinch the urethra closed, is weak or damaged.
So if we think of the sphincter as a shutoff valve, it's essentially a faulty valve that just, can't hold back the water pressure anymore.
Spot on.
Now, historically, I know a lot of people have heard of sling surgeries to fix this.
Yeah, mid-urethral synthetic mesh slings. They've absolutely been considered a gold standard for a long time. They physically support the urethra like a tiny hammock.
But there are issues with that, right?
Huge issues. Our clinical reviews highlight increasing scrutiny over mesh-related complications. We're talking about risks of erosion into surrounding tissue, chronic pelvic pain, and honestly, significant regulatory concerns worldwide.
Wow.
Yeah, so because of this, patients and doctors are driving a massive resurgence of interest in a less invasive alternative, which is urethral bulking agents.
Urethral bulking. It almost sounds like bodybuilding for your bladder neck.
The visual actually isn't far off. Instead of cutting into tissue to place a synthetic mesh sling, doctors inject bulking agents directly into the tissue surrounding the urethra.
Okay.
This literally increases the tissue bulk. It narrows the lumen, which is the hollow opening of the urethra, and increases resistance so that the weakened sphincter can close more effectively against itself.
Let me try an analogy here. Think about having a drafty door frame. The door is your sphincter, and it's just not shutting tight against the frame, so air is getting through.
I like this.
Urethral bulking is like adding really high-tech weather stripping around the inside of the frame. It plumps up the gap so the door can finally form a watertight seal.
Yes, exactly. Taking that weather stripping idea one step further, by bulking up the bladder neck, you improve what urologists call urethral coaptation.
Coaptation.
Yeah, that's just the medical term for restoring the mucosal seal mechanism. The tissues meet in the middle again. But there is a major caveat here.
Always a caveat.
Always. While this is a highly attractive first or second line treatment, especially for a listener wanting to avoid the risks of synthetic mesh, the physical demands of the human body pose a highly unique engineering challenge.
Right, because adding weather stripping sounds incredibly straightforward until you remember that a door frame doesn't do CrossFit.
Exactly.
The human body is this hostile, dynamic, moving environment. And looking at the history in our FDA data sources, adding this bulk wasn't always as safe and refined as it is today, was it?
Not at all. Historically, the internal environment of the body, combined with gravity and physical movement, proved to be incredibly hostile to the materials scientists first tried to use.
It's kind of crazy to read about.
It is. If we look back at the older particulate-based agents from the 1990s and early 2000s, the historical failures are actually quite alarming.
Tell me about it. I was reading through our sources and my jaw dropped. They used to inject Polytef, which is basically Teflon.
Yes, polytetrafluoroethylene.
Mm.
It was eventually discontinued, and not just because it didn't work well over time. The primary reason was migration.
Migration.
Yeah, medical examiners found Teflon particles in distant organs. We're talking about lymph nodes, the spleen, the kidneys, and even the lungs and the brain.
Wait, hold on. Stop there. I need to understand this. They injected Teflon into the tissue around the urethra and it ended up in the brain.
Yep.
How does a physical material just wander off from the bladder neck like that? I mean,
No.
even if someone is a marathon runner, it's not like there's a direct tube from the bladder to the lungs.
No, there isn't. It comes down to the body's macrophage system and the physical nature of those older products.
Okay, macrophages.
Right. A macrophage is a type of white blood cell. Think of them as the body's microscopic garbage collectors. Their job is to find foreign invaders, engulf them, and carry them away to be destroyed or filtered out.
Like a microscopic Pac-Man.
A perfect comparison. The problem with Polytef was the particle size. The Teflon particles were small enough that the macrophages could actually engulf them.
Oh, no.
But macrophages can't digest Teflon. So these immune cells, carrying little backpacks of Teflon, would wander back into the lymphatic or vascular systems, traveling through the bloodstream.
And just dropping them off everywhere.
Exactly, eventually getting stuck in the microvessels of the lungs, the brain, or the lymph nodes. Particle migration became a massive safety concern.
So the body's own defense system was essentially kidnapping the weather stripping and carrying it away.
Essentially, yes.
But it wasn't just tiny particles getting carried away by immune cells, right? I mean, some of these agents just fell victim to pure, simple physics.
Gravity is relentless. Take a historical agent called Durasphere. It used carbon-coated zirconium oxide beads.
Zirconium oxide.
Sounds heavy.
It's a very dense, heavy material. Over time, due to the sheer force of gravity and the mechanical stress of walking, running, and jumping, these heavy microspheres physically dislocated caudally,
Caudally
meaning they just migrated downward through the soft tissue.
So you inject the seal where you need it, and gravity just pulls the heavy beads down into the lower urethra, totally ruining the seal.
And causing new blockages in the process. Another older agent, coaptite, which used calcium hydroxylapatite, was actually linked to urethral prolapse.
Why did that one fail? Did it get carried away or sink?
Neither, really. It failed because it lacked fibrovascular tissue ingrowth.
Okay, what does that mean in practice? Well, calcium hydroxylapatite is biocompatible, but it's dense and chalky. It didn't trigger the body to grow blood vessels into it. It just sat there as a dead weight in the tissue.
Just a lump.
Just a lump. So when you add the mechanical stress of high-impact activity like an explosive jump squat, this non-integrated mass of paste is forced to move. It would push the surrounding tissue out of place, causing prolapse.
Yikes.
Yeah, these early failures forced a complete rethink in how medical science designs these agents for active patients.
Here's where it gets really interesting, because if you want patients to be able to return to their active lives, running, jumping, lifting, without their filler wandering up to their brain or dropping down their urethra, you have to engineer a material that the body actually locks into place.
Exactly. The bioengineering required to solve this starts with fluid dynamics, specifically the concept of viscosity.
Viscosity, okay.
The absolute ideal bulking agent has to be non-migratory. If an agent is too fluid, like the older bovine collagen products we used to use decades ago, the risk of migration increases.
Our sources mentioned bovine collagen would just flatten out. Why?
Because of its fluid consistency. During physical stress, the injected blebs, which are the little pockets of fluid, they couldn't hold their shape against the pressure.
Right.
The surrounding tissue would squeeze them flat, and they would lose their bulking effect entirely.
It's like injecting a pocket of water under the skin and then pressing on it. It just disperses.
Which means modern agents have to operate under a very specific engineering principle called a linear viscosity region with shear thinning properties.
Okay, I'm going to need you to decode linear viscosity region with shear thinning properties. Give me an analogy here.
All right, think about a bottle of ketchup.
Catch.
When it's just sitting in the bottle, it's thick. It doesn't want to pour. But when you shake it or squeeze it hard when you apply shear stress, It suddenly thins out and flows easily.
Oh, that makes total sense.
Modern hydrogel bulking agents do the same thing. They need to flow easily through a tiny microscopic needle during the injection procedure. But once they are in the tissue and the sheer stress of the needle is gone, their macromolecular polymer chains tangle back up.
So they thicken back up.
Right. They become highly stable, cohesive gels that can resist the sudden compressive stress of your body moving.
So they flow when pushed through a needle, but act like a solid shock absorber when you cough.
Exactly.
But viscosity alone isn't enough to stop something from moving if you were doing jump squats. The ultimate precaution, the real genius of modern bulking agents highlighted in our sources, is tissue integration. They are using your own immune system to anchor the filler.
That is the crucial breakthrough that separates modern agents from the disasters of the past. Let's look at how two modern chemical methods handle this. First, there's encapsulation. Agents like PMMA, which stands for polymethyl methacrylate, use tiny microspheres suspended in a carrier gel. These spheres are actually designed to elicit a modest foreign body reaction.
Which usually sounds like a bad thing. You don't want your body rejecting a medical implant.
Rejection is bad, but a controlled reaction is incredibly useful. PMMA spheres are too large for the macrophages to carry away.
So Pac-Man can't eat them.
Exactly. So instead of carrying them off, the body responds by producing a network of fibrovascular tissue around them. It literally encapsulates every single microsphere individually with collagen and tiny blood vessels.
Wow.
This living tissue net permanently locks the spheres exactly where they were injected. They become a permanent part of the living tissue wall.
That's incredible. It uses the body's defense mechanism as an anchor. And the second method.
The second method uses non-particulate hydrogels like Bulkamid. This is a cross-linked polyacrylamide hydrogel. It's essentially 97.5% water held together by a 2.5% polymer matrix.
So mostly water.
Mostly water. And because it has no particles or crystals at all, the theoretical risk of a macrophage picking up a particle and migrating to another organ is completely zero. It's a continuous gel.
But wait, if it's 97% water, how does it stay put?
It acts as a scaffold. Instead of encapsulation, it integrates directly with the host tissue via vessel ingrowth. The body recognizes it as a benign structure, and fine blood vessels actually grow directly into and throughout the gel itself.
Okay, let's bring back the weather stripping idea.
Sure.
The old materials, like the Teflon, were like trying to seal a door by dumping a pile of loose sand on the ground. The wind blows or a macrophage comes along, and the sand just scatters.
Right.
The new agents are like planting a tree. The tree is the hydrogel. Over time, the roots, your blood vessels, grow deep into the surrounding soil, binding with it and holding the entire bank firmly together, no matter how much pressure is applied.
The tree analogy perfectly illustrates the mechanism of vascular ingrowth, and the clinical reviews offer concrete proof that this works. Let's look at the animal testing that precedes human use.
Yeah, the animal studies were wild.
In one recent study, scientists tested a hyaluronic acid-based agent called Zoobex G in New Zealand white rabbits. After 5 months, they did full biopsies of the kidneys, lungs, liver, and spleen.
They were looking for the migrating particles, like what happened with the Teflon.
They were looking for any trace of the injected hyaluronic acid. The results showed absolutely zero concentration differences in those distant organs compared to a control group. None. The material stayed exactly at the urethral injection site.
Okay, that's great for a rabbit, but rabbits mostly just hop. If we are talking about humans returning to high-impact sports, what about an animal model that moves, runs, and sustains physical impact a bit more dynamically? Has this been tested under more rigorous biomechanical stress?
It has. In fact, one of the most compelling studies in our sources involved beagle dogs. The researchers used a plant-based nanofibrillated cellulose, a very advanced bulking agent.
Okay.
They injected it into the urethral wall of the beagles and followed them for 12 months with regular MRI scans. Dogs are highly active, generating a lot of diverse intra-abdominal pressure.
And what did the MRIs show after a whole year of a dog running around?
Even after a full 12 months, the bulking agent was visible, structurally stable, and there were absolutely no signs of migration, fragmentation, or abscess formation.
That's amazing.
It proves the central thesis: when you engineer the material to integrate locally with a host's vascular system, it stays exactly where you put it, regardless of the animal's activity level.
Okay, so the science of the material is undeniably advanced. We've gone from wandering Teflon beads to high-tech hydrogels that actually grow blood vessels. But even with these bioengineered materials that root into your tissue like a tree, the human element is still the final line of defense, right? The procedure itself and what the patient does immediately after are critical precautions against displacement.
Without a doubt. I
Yeah.
mean, the best material in the world will fail if the procedural precautions aren't strictly adhered to by the physician. Correct anatomical placement is vital.
Walk us through that.
The doctor uses a cystoscope, which is a very thin tube with a camera and a light on the end, to inject the agent. But it must be injected submucosally under direct visual control.
Submucosally, meaning just under the mucosal lining of the urethra, not deep into the muscle tissue.
It requires immense precision. You do not want to inject it periureterally into the deep muscle like they did with older agents. The muscle contractions will just squeeze it away.
Right.
But the depth of the injection is a delicate balance. The physician uses the camera to watch the tissue bulge in real time. If they inject it too shallowly, right on the surface, the delicate lining can break down and the material can be left exposed to the open space of the bladder or urethra.
Which we will definitely come back to because our sources highlight a truly wild consequence of a shallow injection. But let's assume the injection is perfectly placed. The doctor plants the tree at the exact right depth, so the procedure takes 5 minutes. If the material is so advanced, can a patient go straight from the urology clinic to a CrossFit class? What happens if they do heavy squats on day 3?
Absolutely not. You cannot go straight back to heavy lifting. And this is where patient compliance becomes the ultimate precaution. The strict rule is avoiding heavy lifting and strenuous high-impact activities for 4 to 6 weeks post-procedure.
If you're an active listener hearing this, 6 weeks probably sounds like an eternity. Why does it take a month and a half to recover from a 5-minute injection that requires no stitches?
Because of the biology of tissue integration we just spent so much time breaking down, that fibrovascular encapsulation for the PMMA or the vessel ingrowth for the hydrogel, it doesn't happen instantly.
It takes time to build the roots.
Exactly. The body has to go through the inflammatory phase, the proliferation phase where new cells are built, and finally the remodeling phase. It takes weeks for the body's immune system to construct that living net of blood vessels around the gel.
So during those first few weeks, the gel's just sitting there, vulnerable.
Very vulnerable. If you introduce massive intra-abdominal pressure, like a heavy deadlift or a high-intensity jump, before the tissue heals and anchors the gel, you can physically displace the blebs. You can push them right down the urethra.
To use our analogy, you are basically pulling the newly planted tree out by its roots before they've had a chance to grip the soil. You ruin the weather stripping before the glue has dried.
That's a perfect way to look at it. The gel needs absolute mechanical rest to settle into its permanent macromolecular structure. You might experience mild burning or a temporary increase in urinary urgency for the first 24 to 48 hours as the tissue reacts, but the real structural work is happening invisibly over those 6 weeks.
All right, so you follow the rules, you wait the full 6 weeks, the gel is integrated, the blood vessels have grown in. But for long-term protection, especially if you are an athlete or someone returning to high-impact sports, there is a physical therapy precaution you can take to protect that newly bulked area, right?
Yes, the biomechanical forces never go away. So for long-term protection, pelvic floor physical therapy is highly recommended. Specifically, mastering a technique known clinically as the knack.
The knack, I love the name. It sounds like a secret physical superpower. What is it doing biologically?
The knack is essentially the practice of consciously pre-activating your pelvic floor muscles. You intentionally contract and lift those specific muscles before you cough, before you lift a heavy box, or before your feet hit the ground during a sudden jump.
I want to make sure I understand the mechanics of this. Most people are taught to brace their core, like tightening their abs when they lift. But this is different. How does flexing a muscle outside the urethra protect the gel inside the tissue?
Think of your pelvic floor muscles like a dynamic muscular hammock supporting all your pelvic organs.
Okay, a hammock.
When you cough, a shock wave of downward pressure hits that hammock. If the hammock is loose, the urethra takes the full brunt of the stretching and shearing force, which could, over years, stress the bulking agent.
Ah, I see.
By doing the knack pre-bracing the hammock, you are mechanically lifting and supporting the urethra from the outside. The muscle contraction absorbs the shock wave before it hits the weather stripping.
So it acts like an active suspension system for the bladder neck. It shields the newly bulked tissue from sudden violent spikes in pressure.
It builds functional strength, reduces overall stress incontinence, and serves as a dynamic shield for your bulking agent. And the beauty of neuroplasticity is that over time, for many people, this conscious pre-activation actually becomes an automatic subconscious reflex.
So what does this all mean? Let's synthesize this whole journey. Stress urinary incontinence is fundamentally a mechanical failure of the body. The weather stripping on the door has worn out. But it can be fixed with a minimally invasive 5-minute bulking injection.
And we ensure that injection doesn't fail or migrate to distant organs like the disastrous Teflon of the 1990s through a combination of three distinct layers of precaution.
Right.
First is the material science, using high-viscosity hydrogels and microspheres that utilize shear thinning physics and trigger the body's own tissue integration response to lock them in place permanently.
Second is the procedural precision, using a cystoscope camera to inject the gel at the exact right submucosal depth, balancing between the muscle and the open urethra.
And third are the behavioral precautions, strictly avoiding heavy lifting for 4 to 6 weeks while the biological roots take hold, and utilizing biomechanical techniques like the knack for long-term support.
It really is a masterclass in working with the body's biology rather than fighting it. If you or someone you know is suffering from SUI, mapping out bathrooms and changing your lifestyle to avoid leaks, but you are terrified of the complications of major mesh surgery, these highly engineered biomaterials offer a safe, effective alternative.
The science has evolved so far beyond the early days. It allows patients to confidently return to high-impact activities without the lingering fear of their filler migrating.
But before we wrap up, I want to leave you with one final provocative thought. We talked about how crucial procedural precision is. We know these modern agents, like Bulkamid, are permanent, durable, and generally very safe. But what happens if the doctor makes a tiny error? What if they inject that gel just a fraction of a millimeter too shallowly and leave it exposed to the open space?
It is a rare complication, but the case study in our sources is utterly fascinating.
The sources highlight a specific case where a Bulkamid injection was left slightly exposed to the inside of a patient's bladder. Because it's a biocompatible hydrogel that is 97.5% water, it didn't poison the patient. It didn't get carried away by macrophages. It just sat there for 10 years.
Yes, waiting.
But because it was exposed to intravesical urine for a solid decade, it acted as a foreign body nidus.
Meaning, it became the biological seed for a crystal to grow.
Exactly. Over 10 years, minerals in the urine clung to this exposed bead of gel, and a bladder stone fully calcified around it. It was just an unexpected, perfectly round stone anchored tightly to the bladder neck.
That is just wild.
It really leaves you wondering, as we continue to engineer these incredible, permanent biomaterials to integrate seamlessly into our bodies, what other surprising microscopic ways might they interact with our natural biology decades down the line? It's a striking reminder that even the most elegant medical solutions are still visitors in the complex ecosystem of the human body.
A very apt reminder. Human biology is constantly adapting to whatever we put inside it.
Well, next time you are at the gym doing a heavy squat or just letting out a massive sneeze, just think about all the complex physics, the macrophages, and the bioengineering keeping everything right where it belongs. Thanks for diving deep with us.